Okay, now let's get into another set of questions to keep practicing our abilities, how to zoom in on what the test writer wants for an answer by looking at the clues that he's left for you. All right, we're going to go through another set of questions. Again, we cover up the answers and read the question. The question reads, which of the following best describes the status of cerebral autoregulation in the affected hemisphere at this time? So that's a concept. If you remember autoregulation, we talked about in vascular phys, and that's where if you keep the systolic pressure between 60 and 160, then blood flow to the three most important organs, which is brain, heart, kidney, remain exactly the same. 68-year-old man with a history of hypertension and type 2 diabetes mellitus presents to the emergency department 2 hours after sudden onset of right-sided weakness and slurred speech. So it sounds like the person's had a stroke. Sudden loss of body function, always think it was stroke. So since it's the right side of the body's weak, that means it's a stroke on the left side of the brain. His blood pressure is 185 over 105. Notice 185 systolic is above the systolic of 160. So that means this person is no longer under autoregulation. Pulse is 88 per minute and irregular, which tells you most likely the person has atrial fibrillation. And temperature is 98.8. Neurological examination reveals right hemiparesis and facial drooping and dysarthria. All right. Non-contrast CT of the head shows no acute hemorrhage, so at least we know it's not a hemorrhagic infarct, which means it has to be an ischemic infarct. So ischemic infarct, if you remember, has a better prognosis. CT angiography reveals occlusion of the left middle cerebral artery. Typically, anytime you have any aphasia, it's going to be the parietal lobe that's involved, and that's usually the middle cerebral artery. He receives intravenous alteplase, which is a drug that cleaves plasminogen to plasmin for you, and undergoes successful mechanical thrombectomy. 6 hours post-procedure, his blood pressure is 145 over 85. So notice systolic has dropped from 185 to 145. That's a 40 millimeter drop. And diastolic has dropped from 105 to 85. So that's a 20 millimeter drop. His blood pressure is 145 over 85, and neurological deficits have improved. That's what you expect. Transcranial Doppler ultrasound shows restored flow in the left MCA with a mean flow velocity of 65 centimeters per second, which the following best describes the status of cerebral autoregulation in the affected hemisphere at that time. Now, remember I said this is the way you should be doing a question. Assess what you're reading as you're reading. Don't wait till the end. Now notice as we assessed everything that we read, we said the person is outside of autoregulation because the systolic is above 160, which means autoregulation has been lost. So we start by looking for answers that say autoregulation has been lost. All right, letter E says autoregulation is abolished permanently due to neuronal death. Well, that's not true. Autoregulation is enhanced with increased vasoreactivity. D, that's opposite what we want. Autoregulation is intact with a rightward shift at the autoregulation curve. No, autoregulation is definitely not intact. B says autoregulation is impaired with pressure, passive cerebral blood flow, so we hold on to that. And then A says autoregulation is intact with a leftward shift. It's definitely not intact. So that means we have to pick letter B here and then move on.